In this video, we're going to talk to you about nephrostomy tubes. We will review care and maintenance, flushing, common issues or complications, and frequently asked questions. During the procedure, the tube is inserted through your back and into your kidney. The other end of the tube is connected to the drainage bag outside of your body. The nephrostomy tube does the job of your kidneys and drains urine into the bag. You may have two tubes if you need one for each kidney. There is a valve or stopcock on the tubing that allows urine to flow into the drainage bag. The valve is also used when flushing the tubing. There is another valve at the bottom of the drainage bag. You will turn this valve when you want to empty the drainage bag into a toilet. For 24 hours after the procedure, you should not drive, take sedatives, drink alcohol, or take NSAIDs. If you take blood thinners, you will be told when to restart them. You may have soreness at the site for the first 1 to 2 weeks. Even when you start to feel better, you should avoid doing any activity that causes a pulling sensation or pain around the catheter. Daily maintenance and care are required to keep your nephrostomy tubes working and to prevent issues. You should empty the drainage bag when it is half full. Your doctor may instruct you to flush the tubes every day. Every 3 days, you will need to clean the insertion site and change the dressing. We will start by showing you how to remove the dressing, clean the site, and place a new dressing over the insertion site. You will need a mirror or a caregiver to help you. First, wash your hands well with soap and water. Then remove the gauze dressing and throw it away. Always check the area around the tube insertion site for swelling, redness, and/or drainage around the tube. A small amount of redness and/or drainage is normal. 24 hours after the procedure, you may shower and use a soft cloth to wash the skin around the tube insertion site with mild soap and water. Carefully remove any drainage or dried fluids. Dry your skin well. It is important to keep the area around the tube insertion site clean and dry to prevent skin irritation and infections. Do not use creams or ointments around the tube insertion site unless directed to do so by your doctor. Do not submerge in any type of water while you have nephrostomy tubes in place. This includes tubs, hot tubs, pools, oceans, ponds, and rivers. It is important to keep the nephrostomy tube covered with a gauze dressing. You can make a loop with the tubing under the dressing to help prevent pulling. Apply a clean new gauze dressing and tape it down around the insertion site. You can shower with the dressing on, but you must first cover it with plastic wrap. If the dressing becomes wet, remove it and apply a new one. If instructed to, you may need to flush the tubing every day to prevent clogging. You will need a 10 milliliter normal saline syringe to flush the tube. Take the syringe out of the packaging and remove the cap. Attach the syringe to the side port on the three-way stopcock by pushing the syringe in and turning clockwise. Make sure the stopcock on-off flow control is in the off position and pointing toward the bag. This ensures the flush flows in the right direction. Gently push the plunger of the syringe to instill 10 milliliters of normal saline. When the syringe is empty, turn it counterclockwise and pull it away from the stopcock. Return the on-off flow control to the open position to allow drainage into the bag. It is important to know when to call your doctor and how to troubleshoot common issues that may arise. Leaking or drainage around the tube is common, especially right after the tube has been placed. If you are experiencing leaking and drainage around the tube, there are a few things you can check. First, start with the stopcock. Make sure that it is in the correct position and allowing urine to drain into the bag. Next, you can check under the dressing for kinks or bends in the tubing that may prevent drainage. Finally, if instructed by your doctor, flush the tubing. If you are unable to flush the tubing, do not force the plunger. The tube will likely need to be changed. If you cannot flush the tube, you should call the interventional radiology department to schedule an appointment. Other reasons to call your doctor. You have chills or a fever of 101.5 or greater, You have severe pain and/or redness around the tube insertion site. You have flank pain, back pain, or side pain. You are not urinating as much or not at all. You have foul-smelling yellow or green drainage, pus, or any drainage that concerns you. Your tube is leaking or falls out. Call immediately for a tube replacement appointment. The number to call is 813-745-2246. Now, some frequently asked questions. Can I swim with my nephrostomy tube? Again, do not submerge in any type of water while you have nephrostomy tubes. This includes tubs, hot tubs, pools, the ocean, ponds, and rivers. How long will I need the nephrostomy tube? That depends on you, your treatment plan, and your doctor's recommendations. Does the tube ever get changed? The tube will be exchanged every 3 months for as long as the tube is in place.